India reports over 4 lakh cases, 4,000 deaths in 24 hours, the second consecutive day of over 4,000 officially reported deaths. Mumbai's positivity rate drops to 7.37%. In Karnataka, though, the positivity rate goes up to 32.7%, 10% more than Delhi. 80 staff members at a Delhi hospital test COVID positive in a month. One doctor dies. Surgeon Dr. A.K. Rawat, who was just 58 years old, who had received both doses of the vaccine, succumbs to COVID. Delhi's lockdown is extended and tightened. Can't afford any leniency right now, says the Chief Minister. The positivity rate drops from 35% to 23%, but it's not enough, say doctors. And the suspense is over. Himanta Biswa Sarma to be the next Chief Minister of Assam. The Bengal Chief Minister writes to the Prime Minister to exempt COVID-related items like medicine and equipment from custom duties and GST. The Finance Minister responds, full GST exemption would be counterproductive. The pandemic brings out the worst in us. A woman who's made Hyderabad's Gandhi Hospital her home after her brothers threw her out, fearing she was positive. Natasha Narwal's father, Mahavir Narwal, has died without being able to meet his daughter. Natasha Narwal is undergoing judicial custody in connection with the CAA protests. The top story at this hour: India has recorded 4,03,738 fresh COVID cases and over 4,000 deaths in the last 24 hours, taking the overall caseload to 2.22 crores. The numbers in Karnataka are especially concerning. The positivity rate in the state has gone up to 32.7%. Nearly 48,000 new cases and 500 deaths have been reported in the last 24 hours. Bengaluru's positivity rate, though, is down to 38%. The city has reported over 20,000 new cases in the last 24 hours. West Bengal has recorded its highest ever new infections with nearly 19,500 cases. 124 deaths have been reported in the last 24 hours. This means there have been over 100 deaths daily in the state for the last 3 days. Some good news, though, from Mumbai. The city's daily positivity rate has fallen to 7.3%. There have been 2,403 new cases and 68 deaths reported in the last 24 hours. The overall recovery rate, 91%, while Maharashtra has seen over 48,000 new cases and 572, COVID deaths reported in the state today. Delhi has seen over 13,000 new cases and 273 patients who have died in the last 24 hours. But the silver lining here is that this is the lowest number of new cases we've seen in one day since the 12th of April. On the 12th of April, 11,491 new cases were reported. However, these new cases could be decreasing because of a lack of testing. And now, for the first time since the 21st of April, there have been less than 300 deaths. On the 22nd of April, there were 249 deaths, and the positivity rate has come down to 22% during the last 24 hours, the lowest since the 16th of April. So what's behind this surge in cases and deaths in the second wave? Well, the World Health Organization's chief scientist says that a COVID-19 variant that's spreading in India is more contagious, that may be dodging vaccine projections, and that could be contributing to India's explosive outbreak. And at Delhi Saroj Hospital, around 80 medical staff have tested positive between April and May, and one surgeon, Dr. A.K. Rawat, who was just 58 years old, who had received both doses of the vaccine, succumbed to COVID. In his last conversation, the surgeon said, "I will be all right." And he believed this because he had been vaccinated with both doses. This grim news comes at a time when hospitals are already overburdened and stretched. NDTV spoke to the chief medical officer who confirmed this news.
Close to 80 medical personnel and a surgeon at Delhi's Saroj Super Speciality Hospital tested positive for coronavirus in just the last month. Dr. Anil Kumar Rawat, a senior consultant and a surgeon at the hospital, succumbed to the deadly virus. Dr. Rawat was administered both doses of the vaccine, after which he contracted COVID.
ये जो पॉजिटिव है ये ऐसा नहीं है कि आज ही सब पॉजिटिव आ गए।
जी, right.
The disease started mid-April, early April से लेके आज तक तकरीबन 80 के आसपास हमारा स्टाफ इंक्लूडिंग डॉक्टर, पैरामेडिकल स्टाफ, एडमिनिस्ट्रेटिव स्टाफ सब मिलाए अगर तो करीबन 70-80 के आसपास पॉजिटिव आ चुके हैं। उसको 2 डोज लगे थे जैसे सबको लगते हैं।
Okay.
1 dose in January, 1 dose in February.
In his last days, colleagues remember Dr. Rawat, who served the hospital for 26 years, as someone who put up a brave fight.
He said, yes, I am having COVID, I am having a respiratory problem, and but I need to I got vaccine.
The private hospital just last month had moved the Delhi High Court seeking directions for immediate supply of oxygen, but the chief medical officer clarifies there is still anxiety.
There is little improvement in getting the oxygen.
Okay.
One thing is upsetting is that anxiety is always there when we will get the next lot of truck for oxygen.
The city's hospitals are stretched, but at the same time reporting its own staff being tested positive for COVID. But the medical fraternity too has reached its exhaustion point and also mourning the loss of their colleagues. In Delhi, with camera person Ashok Mahale, Shunakshi Chakravarti for NDTV.
Punjab has been facing a shortage of oxygen. The centre has increased the allocation of oxygen to the state, but the problem is the state is unable to transport or carry this oxygen that is allocated to the centre to the state due to logistical constraints.
As cases rise in Punjab, many like Sarabjit Singh have had to struggle to get their relatives admitted in a private hospital with a guaranteed supply of oxygen.
असल में देखा जाए तो ऑक्सीजन लेवल की इतनी शहर में कमी है, इसके ऊपर सरकार को, एडमिनिस्ट्रेशन को ध्यान देना चाहिए। हमारी किस्मत अच्छी थी कि हमें ऑक्सीजन वाला बेड मिल गया। मुझे नहीं पता कि हमारे बाद के कितने पेशेंट जिनको ऑक्सीजन की बेड की जरूरत होगी वो क्या इस हॉस्पिटल से भी वापस गए हैं या उनको मिला है।
The number of COVID patients and oxygen consumption in Punjab has seen a steep spike in the last 2 weeks. On April 21st, there were 2,994 COVID patients in hospitals across the state, which increased by more than thrice to 10,151 by May 7th. Critical COVID patients up by 23% in the same period. On April 30th, oxygen consumption was 203.8 metric ton, which touched 250.6 metric ton in 1 week. The centre's allocation of oxygen to Punjab is 227 metric ton. Despite the allocation of 227 metric ton of oxygen, Punjab has not been able to lift the allocated quota due to logistical constraints. Punjab would need 36 tankers to lift the entire allocated quota from other states and 3 to 4 IAF sorties daily. At present, Punjab has only 18 tankers to lift oxygen from Bokaro, Panipat and Roorkee.
What we need immediately is allocation of 50 metric ton of oxygen in next 1-2 days and इतना ही ऑक्सीजन का allocation अगले आने वाले 4-5 दिनों में और होना चाहिए। टोटल मिला के हमें 100 मीट्रिक टन ऑक्सीजन चाहिए। आज हमारे जो इश्यूज हैं उनमें ऑक्सीजन के अलावा जो हमारे नेबरिंग स्टेट्स जो प्लांट्स हैं वहां से हमारा allocation का भी बैकलॉग चल रहा है। These plants are because of different reasons they are not able to supply us the required allocation. दूसरा इशू है बोकारो जो हमारा अलोकेशन हुआ है वो बहुत दूरी पर है, वहां से टर्न अराउंड टाइम डेस्पाइट आईएएफ हेल्पिंग अस इन फ्लाइंग आवर टैंकर्स देयर वो उतना एफिशिएंटली पॉसिबल नहीं हो सकता बिकॉज आने जाने में टाइम बहुत लगता है।
A number of patients from the Delhi NCR region coming to Punjab for treatment has put the state's healthcare services under further pressure. Chief Minister Amrinder Singh's request to the Government of India to allow the state to import liquid oxygen directly was declined. Cases are rising every day as experts have predicted 10,000 daily cases in this month. And despite this, the oxygen allocation still remains an issue. And to overcome this crisis, states should be allocated medical oxygen as per the rising demand. With Mohammad Ghazali, Revati Hariharan for NDTV.
And Tamil Nadu is going in for a total lockdown from Monday. A lockdown has been announced, and as people have been heading back to their villages, this order issued a day after a daily spike of over 26,000 cases.
Kamachi, a construction laborer in Chennai, has decided to return to her village in Salem with her 2 grandchildren. She's taking the last bus before Tamil Nadu would lock down for 2 weeks. At this departmental store in Chennai, Sakti Kumar and Saranya are buying essential food items for 2 weeks. The couple have a son and a guest at home, and they don't want to take chances.
Even though online shopping is being available, we don't want to take chances because sometimes delivery might not be available in our places.
Any citizen should be socially responsible, so we are trying to stay at home as much as possible.
Tamil Nadu's largest vegetable market at Coimbatore is deserted. The government has shut down the retail wing, which had turned into a super spreader last year, infecting more than 6,000 people. For workers like Periyaswamy, it's a double whammy in less than a year. Murali, an auto driver, is a worried lot. He has 7 members to take care in his family. The lockdown would mean he would lose the 500 rupee daily income he earns now. In his first cabinet meeting, Chief Minister M.K. Stalin asked ministers to ensure total lockdown and oxygen availability in districts allotted to them, besides monitoring treatment, enhancing facilities and quality of food for patients and doctors. With daily tally crossing 25,000 and hospitals running out of beds, this is the first major challenge for Chief Minister M.K. Stalin. This will hit the poor really hard, and already he has announced a relief of 2,000 rupees this month. The state government hopes a total lockdown is the only way to break the chain. In Chennai with Shah Vijay, Sam Daniel, for NDTV.
And this coronavirus pandemic is bringing out the worst in people who are really just struggling to cope with fear, with stigma, on top of economic distress, so much so that in one case it's even turned siblings against siblings.
मेरा मन दिल पूरा टूट गया कितना सफर है 2 रात में इधर उधर
Sharda was thrown out of her home in Hyderabad by her 2 brothers who suspected that she had got COVID even though she had tested negative.
वो 28 days पहले मेरे को एक दिन बुखार आया वो पेन से मैं वो मेडिसिन लाके ले ले तो मेरे को ठीक हो गया तो हमारे भाई वाला बोले ये सब जने को कोरोना आ गया ना जाके ये मुशीराबाद में टेस्ट करो बोले मैं जाके टेस्ट कर लिया उस दिन मेरे को रिपोर्ट में नहीं आया सिर्फ टेस्टिंग का आईडी नंबर आया फिर वो किट ले लेके मेडिसिन ले लेके घर को गए तो तेरे कोरोना आया पॉजिटिव आया तो घर को नकाओ निकाल के मेरे को बाहर निकाल दिया.
For the last 28 days, Sharda has been living, ironically, outside Gandhi Hospital meant for COVID patients, surviving on the 1,000 rupees her brother gave and food distributed by strangers as charity.
अगर खुद उनका बीवी का बच्चे का वो लोगों को आई तो ऐसा बाहर निकल जाते क्या? अबे मेरा मन में नहीं है वो लोगों ने.
In a tragic irony, Sharda got a phone call yesterday informing her that her younger brother had died of COVID.
आओ हमारा छोटा भाई आरटीसी में काम करते उन्होंने कोरोना से मर गए कहते फोन आया मेरे को कॉल आया तो
लेकिन अब आपका अब रिश्ता टूट गया उनके से
मेरे कुछ भी नहीं.
So the tragedy of this young woman who says that She was removed from her own house, as in her parental house, by her brothers on the suspicion that she had COVID. For the last 28 days, she has been outside Gandhi Hospital, surviving in some manner. She has some amount in the bank which she hopes she will eventually be able to take out and take her own home. But the tragedy is that her brother, one of her two brothers, in fact has died of COVID yesterday. That's the news she has got. But she says he is no longer her family, so she has not gone. In Hyderabad, with camera person Nagaraju, Uma Sudhir, NDTV.
And in Madhya Pradesh, those caught violating Corona curfew in Burhanpur district were punished with 1 to 2 hours of physical training and lung bolstering exercises. All of this at least while ensuring social distancing. Go in for a short break. After that, the jailed Pindra Tor activist Natasha Narwal's father dies of COVID, unable to see his child before he died. Stay tuned. Welcome back. Now, jailed Pindra Tor activist Natasha Narwal's father, Mahavir Narwal, has died of the coronavirus. His daughter, Natasha, was arrested in May last year for her alleged role in the February 2020 Northeast Delhi riots. She's been booked under the UAPA since then, and her father, who died today, was not even able to speak with his daughter once, who's been in jail, as he died. Natasha was arrested last year, allegedly for being part of a premeditated conspiracy in those riots. She was booked under the stringent Unlawful Activities Prevention Act. She has been lodged in Tihar jail since then, and many civil society groups have been demanding that political prisoners should be released from jails in the view of the surge in coronavirus cases. And now tonight, her father has died. She was not able to see her father before he passed. And a woman from West Bengal who died with COVID-19 symptoms at a hospital in Haryana was raped by 2 men while she was going to join the protest by farmers at Tikri near the border of Delhi. This is according to an FIR filed by her father. The police say they have formed a team to track down the 2 accused. This after the 25-year-old woman's father filed the FIR. According to the complaint, she came to Tikri from West Bengal on the 10th of April along with the group to join the farmers' protest against new farm laws.
10 तारीख को हुगली से चली, ये वेस्ट बंगाल की रहने वाली थी। 11 तारीख को ये दिल्ली आई। उसके बाद जो इसके पिताजी ने बताया है हमें, उनका कहना ये है कि भाई मेरी लड़की 25-26 की रात को शिवम हॉस्पिटल में दाखिल हुई थी, जहाँ उसका कोरोना का ट्रीटमेंट चल रहा था, और 30 अप्रैल को वो एक्सपायर हो गई थी। उनके पिताजी का कहना है कि भाई मेरे से फ़ोन पे बात करती रहती थी, और उनकी इन्फॉर्मेशन के अनुसार यही है कि भाई मोनोमिता का रेप किया है। अभी जांच शुरू की है, जो फैक्ट्स होंगे सारे सामने आए।
And let's get you 2 big stories that are likely to develop on Monday. West Bengal Governor Jagdeep Dhankar has given the CBI permission to prosecute Trinamool Congress leaders Sovan Chatterjee, Farhad Hakim, Madan Mitra and Sobhatra Mukherjee. Let's go across to NDTV's Arvind Gunasekar here for more on this. Arvind, this comes less than 24 hours before Sobhatra Mukherjee and Farhad Hakim are to be sworn in as ministers in the West Bengal Chief Minister Mamata Banerjee's cabinet.
Yeah, Sarah, in fact, the West Bengal governor has given a prosecution sanction to the Central Bureau of Investigation. The Central Bureau of Investigation had approached the governor, West Bengal governor, to file a charge sheet against all these 4 TMC leaders, including Farhad Hakim and also Sobhatra Mukherjee and also Madan Mitra and also Sovan Chatterjee. Against all these 4 people, the Central Bureau of Investigation had approached the governor seeking prosecution sanction, only with the prosecution sanction from the governor, because during that particular time they were the ministers. So seeking the prosecution sanction, the Central Bureau of Investigation wanted to file a charge sheet against all these 4 people. But what we are being told by our sources, top sources in CBI, is that the governor has given a prosecution sanction under Article 164 against all these 4 individuals. What is also very interesting is that this is not the only, these 4 are not the only accused, only people named in this Narada case. There are other people, including Subhendu Adhikari and others also, their prosecution sanction is pending with the Lok Sabha Speaker for last 3 years. But this time, the Central Bureau of Investigation approached the West Bengal governor in January. But now the West Bengal governor, within a span of 3 to 4 months, the governor has given the sanction to prosecute all these 3-4 people.
And now to Assam, where finally after a week of the Assam poll results, the BJP has announced its new chief minister. The party's northeast go-to man, Himanta Biswa Sarma, has been chosen for the top post over the cumbersome chief minister Sarbananda Sonowal. A tough decision for the party, really, that was announced on Sunday at a legislative party meeting in Guwahati. Mr. Sarma, who joined the BJP in 2015, leaving the Congress, has been seen as a chief minister in waiting for a long time, and he will now be sworn in on Monday.
A change of guard in Assam's BJP government. Outgoing Assam Chief Minister Sarbananda Sonowal all smiles as he congratulates his successor and former cabinet colleague, 52-year-old Himanta Biswa Sarma.
Himanta Biswa Sarma जी के नाम का प्रस्ताव
Despite securing a second term for his party, Sonowal could not ensure another innings for himself as the chief minister. In the run-up to the polls, the BJP did not project Sonowal as a CM face. And after the big win, the party decided to reward Sharma, who has strategized the party's success not only in Assam, but across Northeast in the last 5 years.
আমি যে প্ৰতিশ্ৰুতি দি নিৰ্বাচনত বিজয়ী হৈছিল সেই প্ৰতিশ্ৰুতিবোৰ পালন কৰাৰ দায়িত্ব আমাৰ ওপৰত অহাকালিৰ পৰাই আমাৰ দায়িত্ব আৰম্ভ হ'ব জাতিটোক আমি প্ৰাণ দিব লাগিব জাতিটোক আমি ভাৰতৰ সৰ্বশ্ৰেষ্ঠ জাতি হিচাপে নিৰ্মাণ কৰিব লাগিব আমি ভাৰতৰ বুকুত এক উজ্জ্বল ৰত্ন হিচাপে
For now, Sonowal will remain in Assam as a margdarshak or mentor. But according to party sources, he may once again be given a national role.
Himanta Biswa Sarma Dangoriak বিধায়ী দলৰ নেতা হিচাপে নিৰ্বাচিত কৰিলে মই ডক্টৰ হিমন্ত বিশ্ব শৰ্মা ডাঙৰীয়াক আন্তৰিকতাৰে অভিনন্দন জনাইছো শুভেচ্ছা জনাইছো.
And while Sharma and his council of ministers are to take oath of office on Monday, party leadership is quick to establish that there is no animosity in this leadership handover.
Definitely, it will be a very smooth kind of thing will ahead. Nothing confrontation, no difference between any group or any person. All are committed to do work for the party, do work for the state, and we will do.
The Assam Legislative Assembly will soon have a new leader of the house, a new chief minister, Himanta Biswa Sarma, a man who perhaps was a chief minister in the waiting for a long time. But the task ahead for him is not easy. There is huge expectation from him, and then first he has to fight COVID situation, which is turning grim with every passing day in Assam.
In Guwahati, Ratndeep Chaudhary for NDTV.